guys, Dr. Sarah here. I'm a doctor of physical therapy as well as a run rehab coach that works specifically with women runners with hip pain to get them back to running pain-free. And my question for you guys today is, are you getting what you want out of physical therapy? Are you leaving your sessions feeling better? Are you working towards being able to run, sit, play with your kids pain-free? Let me walk you guys through this really cool study. It was a case report done out of Chris Powers' lab. He is just a rock star in the physical therapy world. But there's this gal that comes in, and she is a 25-year-old gal with a 3+ year history of hip pain. And she does the right thing, and she goes to physical therapy, and they diagnose her with a hip flexor strain, which, side note, a hip flexor strain should not take 3 years to heal. Tissue healing property just states that that's not totally correct, so that's one caveat. But she goes to physical therapy, they diagnose her with that, and she goes to physical therapy for 7 visits over a 9-week span. They talk about doing neuromuscular exercises for her hip and pelvis and working on range of motion as well as a leg length discrepancy. I think decoding that means doing exercises for like her hip and pelvis, maybe some like clamshells, bridges, not totally sure, range of motion stuff, maybe they're working on stretching, I don't know. That's what she did. She reports that after those 9 weeks, those 7 visits, which I don't know how much that cost her, there's absolutely no improvement, okay? Then she gets shuttled. Somehow she finds Chris Powers' lab, and Chris Powers is a physical therapist as well as the person that she's working with is a physical therapist. They do another physical therapy examination on her, okay? There's no imaging done during this time, and they do a full evaluation, like they bring out all the stops, which is really what your physical therapist should be doing. And they give her a physical therapy diagnosis of a labral tear. That is then confirmed only after the fact with an MRI imaging, and yeah, they revealed a labral tear. So then they take it a step further in their physical therapy assessment, and they start to look at her movement pattern. So they start to see that when she's doing activities, she's a runner, so she hasn't been able to run for a while now, and she also has pain with sitting. So about 25 minutes of sitting is kind of her max. So they actually say, okay, you're having trouble with running. Let's look what this looks like when you're doing higher level activity. So they say, wow, 25-year-old girl, when you're doing running, when you are doing a single leg step down from a stair, when you're doing like a drop jump down, so if you're like on a box and then dropping off, your impaired side is showing like a poor movement pattern. You're showing this pattern of weakness, and it's most specifically described as like internal rotation of her femur, of her hip. So she's kind of landing in this like compressed, we'll just call it weak pattern. And they looked in real time, and they strapped this brace on her that like pulls her out of that pattern, and they had her do those same motions: running, a drop down, jump, and then a single leg step down. And her motion and her symptoms improved like quickly with the brace on. So her physical therapy intervention, you best believed, worked on the brace, so using the brace, and then also allowing or giving her exercises and cueing to improve that weak or uncoordinated pattern as she's going through those motions, so she could eventually wean off the brace and not have to like rely on that, but she was able to just kind of do that on her own naturally. So guys, I look at this study and I look at this woman and I think about what was going on in her life. She went to physical therapy, you know, she did the 9 weeks, and she's probably like, I don't know why they told me to go to physical therapy because I don't even feel better. Like, I wasted probably $700 on those 7 visits, because copays are about that expensive sometimes. And I'm not better, but somehow she was able to get shuttled to this other clinic that was able to specifically look at her and give her what she wanted. And eventually in this study, she was able to do all of those things with markedly less pain, and she actually chose sticking with physical therapy over a surgical intervention, even with knowing that she had a labral tear. So my question for you is your physical therapist looking at the thing that causes you pain? Maybe it's sitting. Maybe it's you're having difficulty going on long walks. Maybe you are having difficulty running or squatting. But let's pair your exercises to the things that you are struggling with. I always am pairing my patients' exercises and my clients' exercises specifically with the thing that bothers them. So we're looking at their running mileage and seeing where are you breaking down? Where is it causing you to have problems? And then also where are you having problems with other things like sitting or squatting, and exercises are paired to that. The main goal and the thing that allowed this woman to actually choose PT over surgery was that she felt better after each and every intervention, and she saw the light at the end of the tunnel of being able to return to running, return to her life without pain. So let me ask you again, are you getting what you need, what you want? Are you getting better with physical therapy? If not, it's okay to change. It's okay to get a second opinion. It's okay to get someone that is so well versed in this that they just eat it for breakfast. So if you guys have any questions, feel free to just comment, reach out. Strategywithsarah.com is an excellent way to schedule a call with me. We'll walk through your whole strategy of what you're doing and see how can we improve it, and then decide, like, am I the person that's gonna help you, or am I gonna refer you to someone in your area, or a surgeon or a medical doctor that's really just gonna give you what you need. So hope this was helpful and would love to hear from you guys soon.